Good afternoon. My name is Brendan Donahue. I'm the Project Technology Manager for the Council of Juvenile Correctional Administrators, or CJCA, and I'd like to welcome you all to our webinar offering today, Policies, Practices, and PbS Outcomes to Reduce Isolation and Room Confinement. If you're not familiar with CJCA, CJCA is the membership organization that's representing the youth correctional CEOs in 50 states, Puerto Rico, and also some of the major metropolitan counties across the nation. Now, after 10 years or so of CJCA working with the John D. and Catherine T. MacArthur Foundation under the Models for Change initiative, CJCA was recently awarded a grant from the foundation to establish the Resource Network for Youth Corrections Leaders and Professionals. And our goal with this network is to sustain and expand the knowledge developed by the Models for Change Reform Initiative. The Resource Network is designed to transfer knowledge through training, networking, and strategic site-based training and technical assistance grants. The components of the Resource Network include the CJCA Leadership Institute, which is our annual meeting of state agency directors. We've recently established an online hub or an online social network of sorts for juvenile justice professionals that's part of the CJCA website. And there are also 4 training and technical assistance grants that have been awarded this year in the areas of mental health curriculum, improving outcomes for dual status youth, and progress in evidence-based screening and assessment. Last but not least in those components is, of course, part of the Resource Network. We're offering a series of webinar presentations and open forum discussions. We've had a few of our open forum discussions, but this is the first webinar offering as part of this series. And we're incredibly thrilled and excited to have nearly 400 people registered for today's event. I think that the volume of registrants really speaks to how incredibly important today's topic of reducing isolation practices really is to our field and all of you out there today. Before I hand the presentation over to today's moderator, I want to quickly point out some functions of today's webinar and a little bit of housekeeping. Through your computer speakers or headphones on your computer, or you can call in using your telephone. And my advice to you is that if you're calling in on your telephone, make sure you choose the telephone option that's on your screen on the webinar control panel, which you can see an example of here. If you switch over to the use telephone option, it'll really ensure that you've got the best audio quality and helps reduce any unwanted feedback that we sometimes hear from our participants. If you want to ask questions at any point to our panelists, you can type those questions here on this panel. Because of the volume of people that we're going to have on this call, we're not going to be opening up any phone lines, but feel free to type in those questions here. And don't feel like you have to wait until the end when we have a question and answer section. Just type in your questions as you get them, and we'll try and address all the questions as we can towards the end of the presentation here today. I'll also add that today's webinar is being recorded and archived for future viewing, so if you know anybody that you'd like to have attend or watch at a later date, they'll be able to do so. And we'll also be sure to provide the slides and any other resources or handouts that are mentioned during the presentation to you with follow-up emails. So if you're looking for more information after the webinar, we should be able to get everything into your inboxes by sometime next week. I think I've covered just about everything to get us started. So I'm going to go ahead and turn things over to today's webinar moderator, Kim Godfrey. Kim is the Executive Director of the PbS Learning Institute, the nonprofit organization responsible for overseeing the performance-based standards of PbS programs. Kim will open today by giving you all a quick background on PbS and share some insights on the work we do with PbS facilities nationwide. And Kim, why don't you take it from there?
Thanks, Brendan, and thanks to our presenters and the team here at PbS who's making sure everything works on this webinar. First, I'm going to give a quick introduction to who we are. PbS is a data-driven improvement model grounded in research that holds youth facilities and programs to the highest standards of operations, programming, and services. Agencies, facilities, and programs in 32 states participate in PbS and adopt our guiding principles, committed to treating all youths in custody as one of our own. PbS participants have created a national community of professionals dedicating to making a kid's time in custody a positive and helpful experience that will help him or her become a successful adult. PbS helps the facilities and programs through a continuous improvement process, collecting and analyzing performance outcome data twice a year. The data includes quantitative information from administrative records and incident reports, as well as qualitative surveys of youth staff, and families. PbS is successful today because it started as a collaboration about 20 years ago between two national leaders, the Office of Juvenile Justice and Delinquency Prevention and the Council of Juvenile Correctional Administrators. OJJDP launched PbS in response to the 1994 Conditions of Confinement study that reported poor conditions in facilities, crowding, high rates of injuries and suicidal behavior, little timely medical care, lots of staff turnover. And it also concluded that adherence to the existing policy-based checklist standards had no impact. Therefore, performance-based standards were needed. CJCA, the National Organization of State Juvenile Agency Leaders, was awarded the grant from 1995 to 2004 to develop PbS and implement PbS across the country. CJCA's leadership ensured the program became and remains a meaningful and effective tool for the field. When the federal funding ended in 2004, PbS created its own entity, the PbS Learning Institute, and transitioned to a self-sustaining nonprofit, continuing and expanding PbS. Also in 2004, PbS was selected as the winner of the Innovations in American Government Award, given to programs that uniquely and effectively address a societal problem. The Ash Institute for Democratic Governance and Innovation at Harvard University selected PbS from hundreds of applicants for its successful approach improving conditions of confinement. Since day one, PbS has been working on the use of isolation and room confinement. PbS standards are clear. Isolation and room confinement are not used for punishment, and if used only as a last resort and for a brief and supervised period of time. Any youth who is alone for 15 minutes or more becomes a reportable event for PbS and is documented. PbS facilities work really hard to change the cultures and focus on creating safe, supportive staff-youth relationships that prevent the need for isolation and room confinement. PbS aligns with research showing that a youth's positive experience in custody not only increases facility safety, but also reduces recidivism. As you see, the PbS correction facilities continue to reduce the average amount of time kids spend in isolation to just over 2 hours last data period, which was in October. Similarly, PbS detention centers show a continual decrease in the average time a kid spends in isolation or room confinement to about 6 hours in October. This is hard work. We are really proud of the facility leaders and the staff for incorporating what research is showing about youth brain, adolescent development, and the traumatizing impact of isolation and room confinement on kids. For those of you who work in the facilities, I know it's one of the most challenging jobs there is, and one with an opportunity to have an incredible impact on a young life, perhaps the most significant impact. And for those of us who don't, especially we parents, just think how challenging teenagers are. Defiant, disrespectful, acting out, angry, and needing adults to help them regain control because they can't do it themselves. And that's just a short list of things my own, shall I call them, strong-willed daughters have shown me. Juvenile justice professionals are looking for answers and alternatives. What do we do when a kid acts out, when a fight breaks out, when there's only one staff and he knows something is about to go down if he doesn't separate the kids? How do we create positive facility cultures for kids and staff? The intention of this webinar is to give you some tools to do so. Our presenters from Massachusetts and Illinois will provide you with a model policy, practices, approaches, and data they use to create safe and healthy facility cultures and effective behavior management systems that offer kids the opportunity to do the right thing and develop skills and abilities they need to mature into successful adults, all while relying minimally on isolation and room confinement. Some of their facilities do not use isolation or room confinement at all. I know you'll learn from them as I have, and we'll have some practical tools to put to use as soon as we end this webinar. Briefly, before I introduce the first presenter, I want to share some basics we've learned over the past 20 years from places like Massachusetts and Illinois that are essential to create culture change or sustain and expand a good behavior management system. First, unwavering leaders, committed to creating the change, setting as a goal to reduce and or eliminate isolation and room confinement, and who are willing to take on resistant staff and support staff trying to do the right thing. Staff who care about kids, who understand adolescent development, who've been trained to create supportive and healthy relationships with kids, and enough staff to allow for pulling a kid aside when needed and helping him or her calm down without putting the whole group in jeopardy. Training and resources to promote and support the commitment to only using isolation and room confinement as a last resort and for a short duration, and to support a broad array of alternative, engaging programming and incentives for positive behavior. And lastly, accountability through data. Real numbers that are regularly reviewed, shared, and used as training tools, incorporated into performance reviews, and positively recognized and reinforced. And now I'd like to introduce Peter Forbes, Commissioner of the Massachusetts Department of Youth Services, and a neighbor and friend to PbS and CJCA for the past 20 years, and home of the first model agency operating small treatment programs with little recidivism. DYS facilities were the first to help us develop PbS starting in 1995. A quick picture of the Massachusetts system. There's 60 residential facilities and programs. Their count is down to about 700 kids, 900 staff, 1,200 providers, and an annual budget of about $5.2 million. Peter will tell you about a policy his agency developed, implemented, and uses to sustain an effective behavior management system that staff support and embrace, that give kids the opportunity to do the right thing, and that relies minimally, often not at all, on isolation and room confinement. Thanks, Peter, for your time today and for sharing what many are calling a model policy for best practices on the use of isolation and room confinement.
Thank you. Thank you very much for the introduction. This is Peter Forbes. I guess to kind of break the ice, the genesis of the policy development in Massachusetts it really stemmed from 10 years ago. We had 2 in-custody suicides. One was a boy in late 2003, and one was a girl in early 2004. And obviously that created an awful lot of reflection, review, and through tragedy came a really in-depth review on the facility-based practices. What are we doing? How are we keeping kids safe? Not keeping kids safe? And in that review, it became a number of things became evident. One is that it was clear that we did not have a policy. We did not have data, so it wasn't the activity within the programs was not visible. And in looking at the incidents, one of the things that came clearly to our attention was that a lot of the self-destructive behavior was taking place in kids' bedrooms. So at some point in that process, we realized we really needed to get a good policy out there, establish baseline data, and begin to be able to dig out of the hole that we felt that we were in and ensure the safety of kids. And so, it was a long, messy, convoluted process. We engaged all of the folks that you would have to engage, our staff, our local union representatives, our provider community, external constituents, our executive office. And ultimately, it all started to come together in a policy development. So the policy development really became the nexus of the change. And we also consulted with a gentleman named Lindsay Hayes, who's a national expert on suicide and suicidal behavior in juvenile facilities. And he had put out a paper at that point that I'm assuming a lot of folks on this call have seen that was extremely relevant to us in framing the issue and helping us get organized on a plan to move forward. One of the other things that I would say on the policy development, there are a lot of, for us, there were a lot of trapdoors around, so we really stayed focused on involuntary room confinement, when a staff member actually physically puts a kid in their room against their will. And a lot of related issues like voluntary room confinement, when kids ask to go to their room to time out, chair time, behavior management systems. Obviously, it's a very complicated group of issues, but we really stayed focused on let's resolve this involuntary room confinement issue. And I think that helped us keep the compass that way. So the policy link is up here on the webinar if you want to actually read the policy. And I'm going to comment on a couple of the, I think, emphasis points in the policy itself that I think are really worth mentioning and pointing out. One is that room confinement for us is still available as an option for an acting out situation. If you have a kid that's being violent, it's out of control, you can take him, put him in his room, lock the door. What you cannot do in Massachusetts is you cannot go back in an hour later and give him a hearing and give him a sanction for 12 hours of room confinement. So we took away the punitive use of room confinement, but we allowed room confinement to be on the board as a safety tool, which is, it's a needed tool. I think everybody on the call would understand that. The other thing that we did is we built in very clear supervision requirements. So to the extent that you put a kid in his room against him or her in their room against their will, that you own it. You own their safety, and putting them in there does not resolve the issue. So we built that in there. We felt like that was pretty aggressive but reasonable. We also built in an authorization so that, A, you need some authorization to put the kid in his room. B, as the time goes on, if you can't negotiate the youth out of their room, then you have to get authorization through the chain of command. And what that does is it generates some shared responsibility so that the managers up the chain of command have to recognize what's going on and approve it. And it also allows for additional experience in problem solving what's going on with that kid. If you get to 2, 3, 4 hours of a kid in his room and you can't get them out of there because you don't think they're safe, then you probably do need someone at another level to take a look at it. We also focused on a release strategy. We actually had a year-long work group that spent time on trying to figure out how to negotiate kids. Once you get them in their rooms, how do you get them out and do it in a way that's safe? So we spent a lot of time on that. None of this is easy. All of these issues took time. And the last thing that we did was we built in and this actually took a fair amount of discussion, but we built in at the bottom of the policy an expectation that there'd be a team review of all incidents. And there were discussions about whether or not that should be done through some kind of investigation process or through a central office process. And we generated back to, no, that's really a local program review and opportunity for learning. Obviously, if they need help and they need to seek other levels of support, that would be great. But really, it's an expectation that the programs do that review themselves as an administrative team. So that's a very brief overview of the policy. As far as the data, we have a couple of slides, and one is to show that there was the total use of room confinement went down, and the second slide is the truth in advertising slide that shows that based on 100 days, and this is where the data is really helpful, that based on per 100 days, it actually didn't go down. But what happened is, part of the context on that slide is that the overall caseload went down significantly, and our use of community-based options increased, so that the group of kids that are reflected on the right-hand side of that curve are actually a more acute group of kids. So it's still a fairly healthy slide, and having the data is obviously critical. The next slide shows, what we try to do there is essentially connect this to the PbS process and the facility improvement plans, and that PbS actually, it's been an emphasis point for us in Massachusetts, the issue of room confinement, very consistent with PbS, but it also gave us an opportunity to figure out, kind of where our practice stands based on what other jurisdictions are dealing with. And it was really helpful. PbS actually was a really helpful piece of the compass as we tried to figure this out, because if you're figuring it out on your own, you really don't know what you're aiming at as far as what your targets and your goals would be. And PbS was actually helpful for us to have that available. one of the things that happened, and it doesn't absolutely show in the slide, is that through the use of data, we've been able to really identify over the last year or so the 4 or 5 programs that are really driving the room confinement currently in Massachusetts, which is, without the data, we would never have the ability to say we know where the majority of the problem is and then start to focus there. Hope I'm not going too quick here.
No, you're good.
This actually is one of our wins that we're proud of in Massachusetts, is that we've cut the amount of time that kids actually spend in their room from an hour and a half essentially down to about 3/4 of an hour. So that's, so that's really dramatic progress, and that came through an awful lot of work from the agency through the programs. So we're very proud of that slide, and the fact that, and that demonstrates that room confinement is still being used, but it's being used in an abbreviated way, and kids are spending less time in their rooms. So this is the, again, this is the national shot at PbS and then DYS, which in Massachusetts, our secure treatment programs and our assessment programs are in the PbS process, so those are all committed programs. So again, it's just a comparison slide, and as far as kids spending time in their rooms, one of the guiding concepts for jurisdictions working on this, obviously, is that if we're outcome focused and we want good things for kids, I mean,
You want to talk about some of the things you did to make that happen?
yeah, I mean, the part of what I was trying to say was that one of our guiding concepts is to make sure that kids are in programming and that they're not in their rooms. And to the extent that kids are stewing in their rooms, we're really not going to get the outcomes, the positive outcomes that we want with kids. So the reduction in the length of stay, in my mind, is directly related to the policy and the fact that we made it transparent and that we built in supervisory approval. So this is a safety slide, and part of what happened was when we implemented the policy, there were those in different positions that thought that the policy was ill-advised, that it was going to wreak havoc in the programs, that we were undermining safety. And so it was really important for us to start to try to establish some safety indicators. And one of them was the fact that, throughout the beginning of the process, the idea that kids actually were assaulting staff, that's an important variable for us to manage. We obviously never want to see that happen. And over time, over a period of years, over the past several years, we've actually had a pretty consistent trend down in incidents of client on staff assault. And having this kind of a data element captured really helps when you're working with groups that are going to be opposed to this kind of change, to the extent that you can counter some of their concerns with real live data. It's extremely helpful. And we worked on a number of different fronts, but I thought that the client on staff assault slide was actually really helpful, and that's why we put it up there. So, the top of the slide says policy plus data equals reduced isolation, and I think that part of the policy, the data, and part of what went on in that whole process was that it became much more transparent, and it became an example of when you focus on something and you talk about something and you're clear and you message where you want to get to with people and managers and staff, that you can get there. And it was a protracted process. It took us quite a while. The policy was informed based on research and best practices, and I mentioned Lindsay Hayes, and I'm not promoting his book or his material. I'm just saying that he happened to be a really helpful person in the mix, and that we absolutely could not get to where we needed to get to without the data. The data actually led us to the act of problem solving, and to this day we have a daily report, a quarterly report, and we're regularly looking at trends and how we're doing, and which program looks good on this particular data element and which programs don't, and we're talking to those programs.
All right. We will have, thank you, Peter, questions. We're going to take all the questions at the end. And I know peeking over Brendan's shoulder, I see them coming in. So don't worry, we will get them and get Peter talking a little more. But right now I'm going to introduce Judy Davis, the superintendent of the Illinois Youth Center Warrenville, PbS state coordinator and part of the PbS community since 2007. The Illinois system is made up of 6 facilities. They've got just under 800 kids, 1,300 staff, and a budget of $129 million. Judy's going to tell you about work done in Illinois that began with a grant by the John D. and Catherine T. MacArthur Foundation to the Illinois Department of Juvenile Justice to work with CJCA and PbS to reduce and eliminate the use of isolation in Illinois facilities. Judy will describe some of the tools and strategies she and her team used, how they connected the dots to other practices that impact isolation, such as restraints and injuries, how they use data to continually learn more and develop new approaches, and DJJ's strategy to sustain the successful reductions in isolation by implementing the PbS behavior management program and using PbS data to make sure it works. And just to be clear, PbS stands for Positive Behavioral Intervention and Supports, and as Judy will talk about, it's a behavior management system that focuses on changing kids' behavior by catching them doing the right thing. Illinois is using PbS, the outcome measures, to monitor how well it's working. Thanks, Judy, for sharing your time and your story.
Thank you, Kim. The Illinois Department of Juvenile Justice separated from the Department of Corrections and became a standalone agency. Under the umbrella of the Department of Corrections, many of our practices were influenced by the adult model, so becoming a juvenile justice agency was the first official acknowledgement that youth should be treated differently than adults. Of course, this meant changing the culture in all of our facilities. The director's strategic plan goal was to ultimately eliminate the use of confinement, and the MacArthur Foundation funded the Confinement Reduction Initiative, partnering with PbS. We then used PbS data to measure the success of the initiative. We developed a plan to use the PbS teams at each facility and then traveled to each facility to outline reasonable reductions of confinement events. During the initiative, we monitored the progress using PbS data. We use diagrams to outline the reasons for the need for confinement for each facility. To follow up on the use of confinement, we outlined reasonable reduction plans designed specifically for each facility, and FIPs were written. These FIPs are still in place today. We then used the PbS data collections to outline the status of each facility over a 6-month period of time, which either measured progress or lack of progress. We use this slide because it contains a great deal of information. I'm going to move on, but if you have questions, we can revisit this slide later. As we traveled around the state and talked with staff, several facilities recommended the use of timeout and mediation as an alternative to confinement. They also recommended using the 2 tools together, timeout to first offer a cooling down period, especially after a fight, and then mediation to talk about how the altercation could have been handled and how they would handle it in the future. We listened to staff and are listing these 2 tools as examples. One of the other reasons for kids going to confinement is misbehavior in school. The Ready to Learn classroom is another tool used to redirect non-compliant behavior, but allows the youth to stay in the school area. During our last site visit to Illinois Youth Center Harrisburg, we spoke with the RTL educator. She described her job as the de-escalator, allowing the youth to vent their anger to help them achieve a more relaxed mood, with the ultimate goal of completing RTL assignments and returning to class. On another facility site visit, youth noncompliance in the RTL room may lead to a timeout. But once the timeout is completed, the youth is expected to return to RTL to complete the original task before returning to the classroom. We also told staff they need to walk before running. So we suggested that alternatives to confinement first be used on technical violations. These are the nuisance behaviors: insolence, disobeying a direct order, program noncompliance. And after staff became comfortable with this, we later included physical confrontations that were spontaneous or unplanned, such as a basketball fight, bumping into one another in the hallway, or mean-mugging each other. Staff learned to ask, do we really need to go to confinement, or can we shake hands and move on? A positive byproduct of reducing confinement events at Illinois Youth Center Harrisburg has significantly reduced 2 additional critical outcome measures. Both staff and youth fear for safety are now below the field average. As we mentioned earlier, all of our facilities are going through major culture changes and are at different stages in the process. During the initiative, we were constantly emphasizing starting a system-wide behavior management program. After the funding ended, our director appointed an internal statewide committee to review behavior management programs and charged them with making a recommendation to the management team. The committee reviewed several behavior programs currently in place in other states and the current behavior programs used in our Illinois facilities. The committee ultimately recommended rolling out PbS as a system-wide behavior management program, and here's why. PbS was already being used in a few of our facility schools with positive results and high recommendations from administrators. We also spoke with a peer PbS program using PbS. After implementing this behavior management system, his facility was able to increase meeting PbS critical outcome measures. PbS is easy to understand, train, and implement. Youth in our facilities know the program from public school, and rules are based on these easy-to-understand concepts. Be safe, be respectful, be responsible. We loved the simplicity. At IYC St. Charles, they've named their rules Grown Man Expectations. IYC Warrenville has named their rules Beatitudes. Illinois Youth Center Chicago named their rules Chi-Town. Illinois Youth Center Pure Marquette has named their rules Three-Piece Suit. PbS, the implementation tips or lessons learned from our experience in Illinois. The PbS core team should have representatives from all areas, including contractual staff. Meeting minutes from PbS core team should be shared facility-wide to enhance communication. It would be preferable to train all staff during annual cycle training before PbS implementation. You also need to have plenty of staff buy-in. Provide staff incentives when caught reinforcing youth positive behavior. Provide many workshops throughout the facility, as well as ongoing training at roll call and monthly department meetings. Provide research and data to staff in early implementation. And I'd just like to step back to staff buy-in. We've been struggling with identifying staff incentives. Currently, we give extra breaks. We've been giving large candy bars, bags of chips. I had to turn down the trip to Disney World and the week off, but so any suggestions, we're looking for them. Also have visual reinforcement throughout your facility, like posters, bulletin boards, and PbS reminders. And make sure you get the kids involved, because they love to make posters and do bulletin boards. Also, involve your youth council and let them make suggestions for youth incentives and privileges. One of the things that we're going to try to do here is add PbS objectives to all of the staff evaluations. And make sure you have a solid implementation plan at all levels. The PbS trainer emphasized that all facilities use the same data to measure success. These are the critical outcome measures that we are using to measure success of the behavior management system. Based on where we are with the rollout, the October 2014 data collection will be the first collection month that will capture these critical outcome measures. We saw a reduction of our confinement after the initial practice changes by adding timeout, mediation, and our ready-to-learn rooms. Now, with the implementation of PbS, we anticipate that confinement usage will continue to reduce, and then we'll have a positive impact on our other critical outcome measures above. 4 out of our 6 facilities have been trained in PbS. The last 2 are scheduled for training in May and June of 2014. The 4 trained facilities are in varying stages of implementation, which allows the core teams from each facility to share information, offer support, and mentoring. Being one of the long-toothed superintendents in Illinois, I would like to say that Illinois has made significant progress in changing our culture and is much further along in providing a positive juvenile corrections environment. Thank you for sharing the webinar with us today.
Thank you, Judy. That was great, and thanks again to Peter. Brendan has a slew of questions for both our presenters.
Thanks, Kim, and she's right. I do have quite a bit of questions coming in, but please continue to do so. Remember, you can type in your questions to the webinar control panel. Feel free to ask questions to any one of our panelists or today's moderator, Kim. And I'm also already receiving a lot of great messages to our presenters saying that they've received a lot of great information here today and thanking you for presenting. So I wanted to share that early on. So one of the first questions I have here is probably a good one for Peter Forbes. And I've got a question from Ed, and Ed says, besides training of new staff, how do you constantly reinforce culture change that is taking place in DYS?
Well, I think that's a good question, and it's a complicated answer. You have to have an agenda to keep things moving forward, and in our agency, obviously senior level managing and messaging around where we're trying to get to with kids and what the big picture looks like and how programs fit. But we've also more concretely invested an awful lot of time in dialectical behavioral therapy and made a commitment to DBT across the agency and engaged staff on that. And we've engaged DBT coaches to be deployed at the program level to spend time coaching staff. As far as keeping staff focused, one of the things that we've done is we've worked on a curriculum called Empower Your Future, which really puts the kid at the center of the discussion. And staff have really been involved in that, where youth have voice at every stage of decision making. One of the wins that we had in the DBT process was we were able to, a couple of years in, shift DBT away from almost an exclusively clinical piece and get our direct care staff really immersed in it, so that we have our, what we call group workers, are actually co-facilitating DBT groups with the kids. And what they're doing in that process, they're contributing, but they're also learning the skills themselves. So we've done a lot of different, a number of different things. And one of the things that we've been working on in the agency that's been very productive for us is we've been training through the agency on the research around adolescent brain development, and what Judy was talking about earlier. You know, what is typical adolescent behavior, and what is behavior that you really have to be concerned about, and how do you react to that, and trying to equip our staff from a professional development standpoint with more insight and more skills to work with kids. But it's been a really prolonged process.
Thank you. I've got a couple questions that are all kind of similar here, so I'm going to break them out a little bit, and I'm actually going to ask both of our panelists here, Peter and Judy. I'll start with you, Peter. What are some of the benefits that you've seen for the youth since you've taken on some of these changes?
Well, the room confinement, you know, DBT and the room confinement policy ran somewhat parallel on the timeline in our agency, and one of the big benefits that we've seen is a very clear reduction in suicidal behavior, and we capture that, we measure that and capture that on attempts, gestures, and ideation. And we've seen a reduction, a trend line reduction over a period of years on that really important kid safety factor. The other piece has been, it's forced us to have a very deliberate conversation with staff about their role and their expectation to be engaged with kids, and it's been part of a really healthy discussion in the agency that has created a better climate for kids and staff, because we've had to affirmatively have that conversation about what expectations are and what staff are expected to do, and what, you know, how kids are supposed to be treated. And then I think as a result of that, the staff have you know, felt more comfortable in the work environment, because they're contributing more to what's going on with the kids.
Thank you. And why don't I take that same question and throw it over to you, Judy. So what benefits to youth have you seen since implementing many of these changes?
Well, I think that I can talk to, let's talk about the RTL classroom. I think that we are seeing fewer disruptions in our school programs because we do have the RTL, and the kids don't have the opportunity to misbehave and then get out of school for the day. Not that our children would do that, but because they have to be recycled through RTL, it has just cut down on kids leaving school. And I think, you know, we're at a different stage than Peter is with his state. So because we are truly changing the culture in our facilities, these tools that we've started using have helped us really reduce the number of confinement events and significantly reduce the duration of our events.
That's great. That's great, Judy. Thank you. On a similar note, and Peter, you started to say some benefits to staff, but maybe more specifically, I've got a question from Dave here, and Dave asked, have you seen benefits to staff on a professional level in their skills towards negotiating and establishing improved relationships with the youth? Do they ever talk about their improved skills or any of their resistance in the early stages?
Yeah, I mean, as far as staff, I mean, our approach has been to really pick up the pace, to get beyond just basic training at the point of hire, and to offer more ongoing opportunities for line staff and group workers and supervisors to get professional development and that includes negotiation skills. Motivational interviewing has been a big rollout in the agency, the adolescent brain development. So we've done a lot of foundational training with staff and try to create an environment where kids are treated respectfully and expectations for staff are clear. And we've also had the real the benefit of a drop in census where we have a richer staffing ratio where it's easier to pull staff off the floor. So we've made some strides, but we've also been very fortunate.
And Judy, how about the same question to you? Are there any particular staff benefits that you've noticed in recent times that you'd like to weigh in with as well?
I think some of ours are similar to what Peter was talking about. Since we're doing the mediation and timeout, we have, when we're doing the mediation, we try to combine the counseling staff with the security staff and make it, both of those departments are there with the youth when they're doing the mediation. We include security staff in our group process as well as co-facilitators. So I think the benefit is it pulls the staff together more of the team, and it becomes a team effort. But again, I think we probably are not as far along as what the state of Maine is. We look forward to that.
All right. Well, I've got a question here from Stephanie, and it's a question that I hear a lot when it comes to isolation and time spent in isolation is when youth pose a great threat of assaultive behavior to other youth or to other staff, what's an acceptable amount of room confinement? And I'm going to throw this one over to you, Peter, with the policy, and maybe talk about a little bit more about the time and the approval process.
Yeah, we've been really careful to focus on what's going on with the kid versus how much time they're actually in the room. And, whether or not 30 minutes or 40 minutes is an appropriate amount of time for a kid to de-escalate, that doesn't mean that they're absolutely ready to go sit in the TV room with everybody else or go right back into class full speed. But the idea, one of the things that we worked on, we've done a fair amount of work on, is when are they ready to come out? When can you actually open the door? And then what's a safe exit strategy so that you can do something between having a kid actually locked in their room and having a kid full-blown in the TV room. And I think that to the extent that you leave that decision strictly up to a line worker, that's very difficult. But if they're able to consult with clinical and managers and other people on the floor and get some support around the decision to, okay, we're going to open the door. Okay, now you're going to come out and we're going to stay in this part of the program in the hallway for a period of time until we're ready to start talking about whether or not you can start interacting with the rest of the group. So trying to make it so that it's not an all or nothing situation, and also set it so that particularly your less experienced staff have a lot of support and that they don't have to make those decisions by themselves, that it's really a program level decision, not just that line staff. And I know it's a long-winded answer, but also to make sure that the person that put the kid in the room is not absolutely the person that's negotiating the kid out of the room, and to keep that personalization and the anger and whatnot out of it and keep it on a professional level. So sometimes you have to kind of change who's talking to the kid.
Thank you. I've got a quick, let's do an easy one here. A couple people are asking about the size and the average daily population. So maybe I'll have both of you, and I'll give Peter a break here. Why don't I start with you, Judy? Could you just give a quick highlight on the average daily population? Are any of them over 100 facilities, holding over 100 juveniles, ratio of staff youth?
We have 3 facilities that have over 100. Harrisburg probably averages about 175. IYC Kiwani is probably right around 200. And IYC St. Charles is 250. And then we have 3 smaller facilities. Chicago averages probably around 80. IYC Pere Marquette has a capacity of 40. And IYC Warrenville averages probably around 45. And Warrenville is the facility for girls.
And Peter, how about Massachusetts?
So
it's a different story.
Yeah, in Massachusetts, in each region, we have 5 regions in the state. Each region has a secure campus that would have probably somewhere around 60 to 75 beds across different program types. But all of our living units are in that 12 to 15 bed range. And our ratios are generally around 1 staff to 4 kids on awake shifts and one staff to 7 kids on the overnight a sleep shift. So we're really fortunate to have a fairly rich direct care staffing ratio, as well as a clinical staffing ratio and educational staffing ratio that's really it's really supportive of running a good, tight therapeutic program. And we're really happy and understand that that's not the case everywhere.
It certainly is not.
So I've also got a couple questions that are kind of related, and I'll start with Judy on this one again. And it's going back to your slide with that diagram. You had sort of this cause and effect diagram that said what are the factors that are leading up to isolation. And that diagram also included some data on perceptions of safety. I think there was youth fear for their safety, staff fear for their safety. Just one of the questions is to get a little bit more of an interpretation on how those changes in staff and youth safety and relate to the changes that you've made in your practices.
Well, we're always trying to reduce staff fear for safety and youth fear for safety, and basically the research states that if you can reduce your confinement time and use of restraints, physical restraints, and staff and youth injuries, then staff and youth fear for safety will be reduced. This particular slide that we had in the PowerPoint is from one of our facilities, and I think this is from St. Charles, but a good example of where it was reduced when confinement came down was at Illinois Youth Center Harrisburg. They're like our shining star for reducing youth and staff safety when they reduce their confinement and use of restraints.
And that's all perceptions off of the PbS surveys that you give to youth and staff?
Yes, sir.
Great. So how about for Peter and the policy changes? So I hear this a lot too with staff, is that putting youth in confinement will help minimize some of their fear. Now that that's no longer the case and they're not using this as a sanction, do you feel that staff are starting to report that they're safer now that they're getting back into the programs?
I don't know that we have the data to really back up that answer. I know that early on, one of the things that really intrigued me about the PbS process was that question about kids and staff and do you feel safe in your programs. And obviously that's like a very basic fundamental thing that we have to deliver, that if you don't feel safe, then we're not going to be able to do all the other things that we want to do. So we're still focused on that and keeping an eye on that through that process. One of the things that we did in Massachusetts through this whole process is institute what we call an IRT, which is an incident review team. And the staff, one of the things that was going on early on was that staff were indicating through some leadership through the union that they essentially were going to take more cases to court. So if we're not going to get the support in the program, and these kids are going to be violent, we're going to initiate criminal complaints on these kids. That's the last thing that anybody on the call wants, is to have kids generating offenses while they're in secure confinement. We don't want that to happen. And so we instituted what we call the incident review team, which is really it's a collaborative response where regional managers, program managers, the client advocate, they all meet with the youth after this kind of an incident. It's an opportunity for the staff that was harmed to sit at the table and do some debriefing and moving forward with the kid. And sometimes that can mean that a kid's going to have to move from one program to another. It can mean that a kid may wind up having his time assignment, if he's a committed kid, having his time assignment extended. And some pretty strong measures that we would take to get the message to the kid that this is not acceptable, and to get the message to the staff that they're being supported. And that's turned into a much more productive process than feeling like, okay, I'm not safe, I've been hurt, I'm going to court, and I'm going to proceed that way. And the IRT is actually a much more immediate process for the staff, because a court case could take the better part of a year, and the kid's still sitting there. So we've done a number of things on that front, trying to be creative to give staff support so that they feel as though the environment is safe and that we're taking this seriously.
Okay, so I've got a couple questions that are actually on some of the graphs that were used with the PbS data, and both of you made comparisons to your facilities and then compared them to a field average or a jurisdiction average. And maybe, Kim, why don't I give my two panelists a break here? Why don't you just give a quick explanation as to what the jurisdiction and the field averages are?
Sure. PbS gives all the participants what we call the field average, just as a benchmark, as Peter said, something to compare to what's going on with other like facilities around the country. And all it is simply is the average of all the participating facilities. You break it down whether you're correction, detention, an assessment center, community residential program. You can also do field averages to compare girls programs to just girls programs, whether you're large, over 100 beds, 50 beds, small facilities. So the idea is that it's hard to know what's going on in other states, and so much of what I think some of PbS information has helped people do is realize that they are either in alignment what is best practice going on around the country or not, and it's just a very quick visual to see where you're doing. And additionally, what we give is every state jurisdiction or jurisdiction with many facilities the ability to create their own average. And what Peter in Illinois, because both Massachusetts and Illinois have so many of their facilities participating, they get an average of how their state does compared to the field. Again, it's all information for them to use, as these two have said so articulately, to see what works, make some changes, and just keep monitoring what's going on in the facilities.
Well, I want to make sure I squeeze in a question about PbIS, since Judy took the time to tell us all about her implementation of that. And you had mentioned, and I'm looking for the question here so I could see who it came from, but you had mentioned possibly using some PbIS elements in the staff reviews, and I wasn't sure if you were far enough along or knew enough at this point to what you planned on using in that.
Well, all staff get an annual evaluation, and you know, we have PbS objectives in all of our staff evaluations. So we would just write a goal maybe for supervisors to make sure that all of their staff are implementing the tools that are under PbIS, and then write different kinds of goals for the line workers. But I think it's important that, you know, we hold staff accountable for using the behavior management system. I mean, it's been, you know, we've had many changes in our facilities since 2006 when we came out of Department of Corrections, and it's just a matter of, again, you know, holding staff accountable for implementing changes. But I mean, we have, like I said, we have made significant culture changes, and this is just another stepping stone. I think that putting it in evaluations will help us keep it focused from the top down, because if it's not, I mean, everybody from the superintendent down needs to support the behavior management program, or it won't work.
Thank you again, and I'm showing it's 3 o'clock, and it's a 1-hour presentation today, and I really want to thank again both of our panelists, Peter Forbes and Judy Davis, for joining us here, because we've got a lot of questions that are still left, and I really appreciate all of you asking such great questions, and I'm sorry I couldn't get to all of them in the time that I have. but we have taken a log of all the questions, and we're going to do our best to follow up with each of you if there's anything that we can answer after the presentation here today. Again, the webinar presentation will be archived, so you can go back and rewatch if you want to do so. We'll also do the webinar slides as a handout. You can get that as an attachment. We've posted a link to the Massachusetts policy in the chat area, and we'll be sure to provide that link with you afterwards as well. I mentioned earlier that this is the first of a webinar series, and our next webinar is going to be in 2 weeks, as a matter of fact, all through the Models for Change initiative. On May 16th, from 2 to 3 p.m., the topic of the next webinar is dual status youth and their families. So these are youth who are involved in both the criminal justice system and also the child welfare system. It's going to be presenters from the Robert F. Kennedy Children's Action Corps. The link to register is available in the chat. We'll follow up with that in an email as well. For more information on CJCA, you can follow us on your favorite social networks. If you've got Facebook, Twitter, Google+, we're out there on those. If you like to keep it strictly professional, you can follow the LinkedIn page, the YouTube account. We try to back up all of our webinars, and there's also some other great informative information on the YouTube. And most importantly, our blog is something that has really taken off as of late on CJCA. If you're a blog reader, subscribe to our blog at CJCA.net. So one more time, on behalf of Kim Godfrey, Executive Director of PbS, Peter Forbes, the Commissioner at the Massachusetts Department of Youth Services, and Judy Davis at the Illinois Department of Juvenile Justice, I'd like to thank you all for attending, and I hope you all have a great remainder of your Friday and a great weekend. Thank you again.